infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey, everybody. This is Robert, and welcome to Outbreak News Interviews. Now, it's not a worm, but it's a fungus among us. Today's topic is going to be ringworm. And joining me today is Regents Professor of Clinical Laboratory Science at Texas State University and author of an article published in The Conversation About Ringworm, published last year, but definitely a topic worth discussing today, is Rodney Rohde, PhD. Dr. Rohde, welcome back to the show, sir.
Thanks, Robert. It's always great to join you on this topic of ringworm and so many others we've talked about over the years. So thank you for having me on.
For you that are new to this podcast, Dr. Rohde's been on 10 times, maybe more. I can't read. I lost count, but he's kind of a regular. But let's go ahead and start out with the ringworm. What is it, and how common is it?
Yeah, so ringworms are, what they typically evoke for most people is kind of what you mentioned in the startup of this, is that some people actually think it's a worm infection when they hear it, but it's actually a fungus infection. And typically, you would think that it's super common, but it's really about 20 to 25% of the population we think experience a ringworm infection at any given time. And so it's a relatively common infection of the skin, the hair, or the nails. Those are typically the most common issues of where someone would get it. And I guess one of the reasons is it can really be found almost anywhere. Fungi are found soil, plants, that can be found on other surfaces, and even the skin of different bodies or animals or things like that. So when you look in the literature, you look at places like CDC, you find that we believe there's about 40 different types of fungus that can cause these types of ringworm infection. But just to mention kind of three of the biggest ones, there's kind of a big three here, and they're found in the genuses Trichophyton, Microsporum, or Epidermophyton. And those are a mouthful to say, but those are typically the primary genus that causes these particular ringworm infections. And, as a microbiologist, Robert, I know you've probably seen these. They're really interesting looking under a microscope. The fungi in general can be, some have described them as almost like artwork if you look at them under the microscope. So they're so varied in their appearance, and they have different spore types and different other things that you can look for. So most people in the public tend to see these or think about these when they have something, on their feet or other parts of their body. In fact, some people might sometimes call it athlete's foot or jock itch, or it's even found in the beard area or other places on the body. So usually an itchy rash, and it can be kind of flaky and cracked. So typically not life-threatening, but they can certainly cause a lot of issues with your health.
Now, the term tinea is also used in the same vein as ringworm. What does tinea mean?
Yeah, tinea is just a medical term for ringworm. And you also might have heard of the term a dermatophyte, kind of thinking about dermatology, right? So dermatophytosis is also something that are synonyms for most contagious fungal infections of the skin. So you'll see that sometimes in the literature.
Okay, so this is absolutely a superficial type of fungal infection. Right. So how do you recognize ringworm, and what are the symptoms?
Yeah, so typically when you're thinking about ringworm, if you're looking like from signs and symptoms versus, say, a lab type of test or something like that, you're typically thinking about the spots I just told you. So they're typically going to infect or cause an infection on the hair, the skin, and the nails of either your fingers or toes. Those are kind of likely spots to see it. And it kind of depends on where the infection occurs on your body, but sometimes it can cause hair loss or kind of reddish, scaly, kind of cracked skin where that infection's occurring. And really that, that most well-known sign that really gives the infection its kind of misplaced name ringworm is kind of a hallmark because it's kind of a circular rash. I know most people have probably experienced this, especially if you work in, I've seen this with like daycare workers or childcare or even other adults that might be working with lots of kids or in these types of areas where there's more risk. And you'll see it and it kind of raises up on the skin a little bit. It's almost raised. And sometimes it literally looks like a ring that's under your skin and it's a little higher and it's a little red. And so again, that's kind of a hallmark sign, that ringworm infection, but it's a fungus infection.
So Dr. Rode, how does it spread? Is it a person to person thing, animal to person? Is it in the environment? All of the above?
Yeah, all of the above, right? So it can really be transmitted in three kind of primary routes. It can really show up with close contact. So if another person has it, you can definitely get it through close contact. Again, my wife always talks about this because she's a pre-K teacher, and they typically have at least one or two outbreaks, if you would call it outbreak, of ringworm each year because of the children are so close together and they tend to not have maybe quite the same type of habits of hygiene and things like that with washing hands and stuff like that. So it's easily transmitted from one person to the other when they're infected. You can also pick this up from animals. So different types of animals, both domestic and wildlife, can harbor these types of infections. Sometimes it might even just be on their fur, and you can pick it up that way. It could also be from surfaces, right? So these, if you know anything about fungi, they really grow in different forms. So those of us in the microbiological world know that you can have them in yeast form, or you can have them in kind of this filamentous form. The yeast form are a single celled, pretty simple looking, whereas the filamentous form are, you might have seen these like growing on fruit or vegetables. If you've ever seen even penicillium, right, which is a beneficial mold, will grow on cheese and things like that. But they'll also grow on things like shower curtains, wallpaper. I mean, they're really adaptable to the environment. And so that surface type of interaction with a human or an animal is definitely a possibility of picking up a ringworm infection.
Well, that leads to the next question. How do you prevent it? How do you keep from getting ringworm?
Yeah. So, one of the best ways, it's kind of boring, but it works for a lot of things, and that's washing your hands, right? So good hand hygiene with soap and warm water. That's always a great piece of advice for most types of pathogens. You can, and this really goes into an area that I talk about across all spectrums of public health, and that's One Health, right? So animal health and environmental health are both critical to human health, and that's kind of a One Health perspective. So if you have pets or livestock, certainly you should be having them checked, regular visits. You might be told to use a certain type of shampoo or to take care of your pets in a certain way if they do have ringworm. I hope you're not taking care of wildlife. That would be a problem. And Robert knows I'm a rabies person, so let's not go into the realm of taking care of wildlife. And then with respect to your clothing, right? So these types of pathogens, they really thrive in warm, humid, kind of dark areas. And so you can kind of consider them more prevalent in areas that are tropical or kind of hot, humid summers. So keeping that in mind, you also want to think about your shoes and socks. And so especially if you're in those type of areas, you might want to consider wearing kind of breathable materials, both shoes and socks, to kind of help with that prevention. Perhaps being careful that you're not roaming around barefoot, like in a public locker room or a shower room or something like that, because again, these things might be on the surface of the floor.
So athlete's foot, Dr. Hardy, is considered a type of ringworm?
It is.
Yeah.
So that's a definite kind of no-no. Hopefully people think about that. Now, being at home might be a little bit different, but certainly if you're at a rec center or you're active in sports or things like that, you might want to think about wearing shower shoes or things like that. Not a bad idea to keep your fingernails and toenails kind of regularly manicured and clipped so that you don't have a problem there. We already mentioned socks, even other undergarments. You definitely want to change those several times or several once a day, several times, maybe not several times a day. And then sharing, right? So we've even talked about, one of the other things that we often talk about when we're talking prevention, and you tell even your children this or other people that are maybe not thinking about it, you really shouldn't share clothing. You shouldn't share sheets or hats or towels. You typically don't want to use the same brushes or combs from other people. And these are all preventative measures we talk about with prisoners or dorm students or military barracks, because when you get in those close quarters and you're living together or close by each other, that can be a problem when you're sharing those types of instruments. And then close contact sports, probably a little more rare, but certainly if you're doing a lot of sports where you're a lot of high contact, skin to skin contact, things like that, you might want to think about showering immediately afterwards and kind of making sure all your sports gear, you can see the theme here with sports gear and your body contact and sweating and humidity and things like that, that's going to be a problem. And so kind of keeping those things separate and clean are going to be critical to preventing things like ringworm infection and probably other infections as well.
Sure. So how do you treat it?
So there are different ways, and certainly one thing that might happen is if you see a kind of a hallmark sign, that kind of classic ringworm rash, parents may take you to the doctor or take you to a dermatologist. If your primary care physician sends you to a dermatologist, typically it by visually seeing it, especially a medical practitioner. And sometimes if they're not sure, they might take a small skin scraping. They might do a little hair or nail sample and actually look under a microscope. So I know Robert's done this. I've done it many times where you can actually view different spore types or different types of things you might see. And they're quite easily identified, at least some species are, with respect to looking at them under a microscope. So that could be part of it. So treatment-wise, typically it's going to be some type of antifungal medication. Some of them are over the counter. Sometimes you might need a prescription depending on what's happening. They're usually going to be some type of cream or ointment. And you may have heard of some of these like grisofulvin. There's things that you might get that are over the counter like Lotrimin or Miselex or itraconazole. There's several of these antifungal classes that you might pick up over the counter or through prescriptions to kind of put on topically. Rarely would you typically need, an oral medication, although, and I've talked to this with students sometimes when I'm teaching this topic, is that, if you had a really serious like toenail infection from a ringworm, and Robert, we've talked about this and other people talk about this in the world of microbiology, fungi are similar to human cells. They're eukaryotic. Mm-hmm. And so you have to kind of be careful with oral fungal medications, because sometimes they can also kind of hammer away at your own cells. And so they can affect your liver. And so oral heavy duty antifungals typically aren't used unless it's like some kind of life-threatening problem. And even if you do have some kind of unsightly, ongoing toenail infection and you want to get that cleared up, you're probably going to be monitored if you take an oral antifungal so that they can watch your liver enzymes and make sure everything's going to go okay with your own cell types.
Well, Rodney, while this is a superficial type of infection, does it ever go systemic?
It can. And again, it kind of depends on the bug. But if we kind of keep it general, right? I mean, certain types of yeast infections can certainly become systemic and get into the bloodstream, for example, or things like that. Fortunately, it's not super common.
Right.
But, and if we kind of went back to who gets it, sometimes those more severe infections that you're mentioning here might be immunocompromised individuals. People with diabetes sometimes will get these as foot infections, and they can get systemic. Organ transplants and cancer patients. So you'll sometimes see this even on commercials when they're talking about some type of antifungal medication, and they're typically targeting those types of patients that are immunocompromised.
All right. Well, let's go ahead and close out with this. In 2023, The New York State DOH reported 2 cases of drug-resistant ringworm. Dr. Rode, why is antifungal resistance a growing problem? And now it's even amongst the ringworm organisms.
Yeah, and you and I both know this. We've talked about it some on your show before. So globally, the global problem of antimicrobial resistance is absolutely growing across the world. It's not just fungal infections; it's certainly bacterial resistance and viral resistance and so forth. So that's an ongoing global emergency. In fact, many experts are kind of predicting that if we don't get that under control globally, like holistically, we might end up seeing about 1.3 million deaths, or rather, we already saw 1.3 million deaths from all infections in 2019. And if we don't get this under control, we might see up to 10 million by 2050, which is, that would surpass cancer for some perspective. So that would be really problematic. And when you think about the 2 cases you mentioned, which is really what kind of initiated this article that I wrote for in the conversation, it was really kind of popping up over the last decade or so in South Asia. They were seeing kind of these epidemic antifungal resistant ringworms from a particular species in the trichophyton group, and that typical agent does cause disease in both animals and humans. But the experts in those areas and that have come in really believe that inappropriate use of topical antifungal and corticosteroid medications probably helped, speed up that spread and epidemic within that area. And then, as you mentioned, in February of 2023, we saw 2 of these cases in New York City, and they just wouldn't improve even with oral antifungal treatment. So the CDC report that came out from that stated that those were the first cases from that species in the United States, and that one of those 2 patients had absolutely no international travel. So the concern, obviously, in the publication that came out was perhaps that particular trichophyton. I think this is pronounced trichophyton tinea, which is that term we just talked about. And so they think that perhaps there might be some local transmission popping up in the U.S. So like a lot of stories we've seen in the headlines and we've talked about on your show before, with that global travel, with other things going on, including changes in tropical and subtropical regions, we're seeing this expansion of these types of agents. So it's probably going to continue. That's kind of the world we live in now. And really, it's kind of up to us to diagnose it, recognize it, and try to find ways to help prevent or slow its spread.
Very good. And if you want to check out Dr. Rode's article, it's in the conversation. Ringworm fungal infections are common in the U.S. and becoming increasingly resistant to treatment. And I'll link to it in the show notes so you can check it out. And I want to thank you, Dr. Rodney Rode, for spending your time with us and sharing your knowledge. I appreciate it, sir.
Thanks again, Robert. It's always a privilege and an honor to be on your show. So keep up the great work, and we'll see you next time.
All right. Thank you, sir.